ever wondered why there is a swollen, painful joint as seen in rheumatoid arthritis? What is so unique about the development of the disease process of the rheumatoid arthritis, and why we get anti-CCP antibodies in the rheumatoid arthritis patient? Answer of both these questions are connected, and we try to connect both these dots as we progress in this short session. So we all know that rheumatoid arthritis is an autoimmune disease, and it's an autoimmune multisystemic disease which primarily affects the joints, as the name implies, because the name is telling you it's an arthritis, inflammation of the joints. Now, the key problem, and also we also know that in rheumatoid arthritis, currently the best antibody, the best diagnostic marker we use is that is called anti-CCP antibodies, which stands for anti-cyclic citrullinated peptide antibodies. So this is I'm also going to discuss in a few moments. Now let's try to understand what is the main problem in rheumatoid arthritis. The main problem in rheumatoid arthritis is this, that a process called citrullination occurs in certain proteins, our important proteins in our body. The term is citrullination. It's a 13-letter word. CITRULLINATION, citrullination. What does this word mean? It means it's a biochemical process where many of our important body proteins, which are located in the tissues, particularly in the joints, their arginine get converted into citrulline. That means there are certain important proteins are there in our body, like let's say type 2 collagen, vimentin, they're particularly present in the joints. These proteins get modified and become a different protein through this process of citrullination. Now what happens? Our body's immune system is always looking for this odd kind of proteins that present in the body because they perceive them as antigen or bad things. So suddenly when these normal proteins, they become citrullinated, particularly in the joints, body's immune system starts to think that these abnormal proteins, citrullinated proteins, are bad things. And they present these cells, antigen presenting cells, they present this cell to CD4 plus T lymphocyte. And then all hell break loose actually. Because now a lot of cytokines comes into the picture, a lot of cytokines are produced, and they basically perpetuate this destruction and inflammation of the joints. So the main problem, as I try to re-emphasize there, the main problem is that certain proteins which are present in the joint, they can be present in the other part of the body also, like type 2 collagen and vimentin. These proteins become modified by a process called citrullination in the rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder. So what happens? The patient's body's immune system mistakenly now start to target these proteins, these modified proteins, citrullinated proteins which are present in the joints. And that triggers this disease process, the rheumatoid arthritis. That is the process, the idea of the called citrullination. So what body's immune system would think that, well, these proteins, they don't look like the proteins I am aware of. So probably they are not my friends. They are not the self proteins. There are some non-self. Non-self means not belonging to my own body tissue. So they would perceive these citrullinated proteins which are present in the joints as foreign, as antigen, as bad, and they would attack them. This is the same principle which is used for all autoimmune disorders. That autoimmune disorder means that my immune system is mistakenly targeting my own body tissue. So here the body's immune system is mistakenly targeting my joint tissue. That's the main problem. So this is one part, that citrullination is the key problem. Citrullination of a lot of key proteins, particularly present in the joints. And that's why joint is the main target area in the rheumatoid arthritis, because most of these proteins which get citrulinated, they are present in the joints, it has been seen. Now, rheumatoid arthritis can be seen in other body parts also. It's a multisystemic disorder because this citrulinated protein can be present in other body parts also. So that's why it explains that why this involves not only the joint, but maybe other body parts also, because it's a multisystemic disorder, like skin, like lungs and other places. Now, the next part which I want to explain here is this, that why anti-CCP antibodies are diagnostic for this. So I told you at the beginning that the main problem in rheumatoid arthritis is that lot of normal proteins in my body, they get citrulinated because their arginine amino acid gets replaced by citrulline. So this process is called citrulination. And now body's immune system don't like this process. They perceive this modified abnormal protein, citrulinated proteins as foreign antigens, and they produce antibody against them. So as they produce antibody against them, these antibodies which are produced against these CCP proteins, they are called anti-CCP antibodies. Anti-CCP antibodies. C, the first C is for cyclic, the second C is for citrulinated, and last P for peptide. Now these anti-CCP antibodies are basically targeting those citrulinated proteins which are present in the joint. Now, presence of these anti-CCP antibodies make these anti-CCP antibodies a very useful diagnostic marker for rheumatoid arthritis. They show high specificity, more than 90% specificity, I would say. And their presence, this anti-CCP antibodies even can occur even before the features of rheumatoid arthritis is seen in the patient. So they are an early harbinger of the disease symptoms. They can be seen even before the disease symptoms appear. And anti-CCP antibodies are considered a far more accurate diagnostic marker compared to the rheumatoid factor. So anti-CCP antibodies can be seen in some other condition, but it is far, far more specific than compared to rheumatoid factor. So that's why anti-CCP antibodies are chosen over rheumatoid factor nowadays as a better diagnostic marker or serological marker, I would say, for the rheumatoid arthritis. So the two key takeaway from this session is this. Number one, that the main pathological process which is triggering this autoimmune disorder, rheumatoid arthritis, is called citrulination. Citrulination means some of the proteins in my body, their arginine amino acid become converted into citrulline, which is called citrulination. And that those modified citrulinated proteins are not liked by my body's immune system. So my body's immune system perceive them as bad thing, like a virus, bacteria, foreign antigen, and they start to react against that. And that is how this whole autoimmune process of rheumatoid arthritis gets triggered. This is the number one concept that you need to be clear of. And second thing is that the presence in this process an autoantibody is produced, which is called anti-CCP antibodies, anti-cyclic citrulinated peptide antibodies, which are useful as a diagnostic marker for rheumatoid arthritis. It's a better and more accurate than rheumatoid factor, and its presence can even be seen even before the rheumatoid arthritis features appear. So these are few key takeaways from this session. Thank you so much.